Hi, my name is Alexandra Dumitrescu and I am an endocrinologist from the University of Chicago. I would like to share with you some of the highlights of our recent endocrinology article, which reports the generation of a mouse model for the syndrome of Sbp2 deficiency. During my graduate studies in Dr. Samuel Refetov's laboratory, I identified the first families harboring genetic defects in the Sbp2 gene. Sbp2 stands for sessis binding protein 2 and is an essential factor for the synthesis of the 25 known selenoproteins. Patients with defects in the Sbp2 gene manifest a characteristic thyroid phenotype with low T3, high T4, high reverse T3, and mildly elevated TSH. This is due to the fact that the enzymes that metabolize thyroid hormone are selenoenzymes, the 3-deiodinases. Additional families have been identified based on the pathognomonic thyroid phenotype, and the complex syndrome with multiple additional features has emerged. In my laboratory, we set to generate a mouse model that replicates the features of the human syndrome of Sbp2 deficiency. Lacking Sbp2, it's not compatible with survival. Therefore, we used a Cre-ER tamoxifen-inducible system. When assessing their weekly body weights, it became apparent that Sbp2 deficient mice have failure to thrive, similar to the growth delay observed in patients. Importantly, Sbp2 deficient mice replicate characteristic features of the thyroid phenotype of patients with Sbp2 defect. In our detailed evaluation of tissues, we found that the thyroid hormone status of the liver in Sbp2 deficient mice is more dependent on the circulating T3 rather than on local T3 generation. In contrast, T3 availability and action in brain is decreased in Sbp2 deficiency as indicated by the decreased T3 content and decreased expression of hairless, a positively regulated thyroid hormone responsive gene, thus demonstrating that in Sbp2 deficiency, the brain is hypothyroid as it is dependent on the local T3 generation. Other selenoproteins are also affected, as demonstrated by the significantly decreased glutathione peroxidase activities measured in serum, liver, and cerebrum. This establishes our Sbp2 inducible knockout mice as a suitable model for the investigation of the syndrome of Sbp2 deficiency. If you are interested to find out more, please read our article in the December issue of Endocrinology. Thank you for watching.